Good afternoon, everybody. Bob Brisky here from Pinnacle Financial Services. Welcome to our webinar presentation today. Today, I have with me as well James Norton from our Medicare division, and we're going to go over some changes that have just come down the pike from our good friends at CMS. So a couple of things before we get started. First off, a little bit on the housekeeping side with the webinar. Everybody's on mute today. We've got a pretty darn good turnout. Want to keep that background noise to a minimum. So we do have everything on mute today. We will be recording today's webinar. So if you do want a copy of that, we can make that available to you. On your screen, you should actually be seeing right now, I want to make sure everybody's aware of our YouTube channel. There's a direct link from our website to the YouTube channel. And what we typically do is upload all of our webinar presentations along with other trainings and important information to this site. No login required. If you subscribe to the channel, you'll get updates as well. That'll let you know when we're putting new stuff out there. So a great idea. You want to be on top of all the updated webinar recordings that we're doing, not only on Medicare, but on any product lines, whether it's annuities, life insurance, final expense, or any ancillary health products like hospital indemnity plans. So a lot of good stuff out here on the YouTube channel, and this is where we're going to put the recording of today's as well. So I expect we're going to go about a half hour today. We're going to touch base on a couple of different things to really get into the crux of our call today. So our friends over at CMS last week put out a training that the Medicare Plan Finder on Medicare.gov is changing. Yeah, right? It works so well, they're going to change it up for everybody. So right now, as most of you know that are in the Medicare world, an individual or even you as an agent working with an individual can go on Medicare.gov. You can put in a client's area code, zip code. You can put in some prescription drugs. You can put in a pharmacy. And you can get a whole layout of all the different plan options, the real out-of-pocket anticipated cost. Some really good info comes from that Medicare.gov Plan Finder site. So what has CMS in its infinite wisdom decided to change? So what they're doing, and this is supposed to be going into effect for the upcoming AEP enrollment window. So what they're doing is they're going to make every single individual, before they can use the Plan Finder to find out the best possible option for them, what they're going to do is they're going to make them create an account and make them log in to the Medicare system. So what are we talking about with that as far as the registration goes? Many of you know right now, some seniors real good with technology, some not so much. So there's certainly going to be some limiting factors there if a senior is looking to take a look at the plan information prior to getting on Medicare, because that's what a lot of people do. They start shopping out on Medicare.gov. They want to take a look at what plans might be available to them, a lot of times even before they're working with a professional, an insurance professional. So that's going to pretty much go away if they're not very computer literate and they got to start creating passwords and IDs and logging in. But many of you may have already seen the registration process for Medicare.gov. So you actually need a Medicare ID to register. So those individuals that don't already have a Medicare ID, that are not quite into Medicare yet, and will not now be able to create an account, are not going to be able to do this. They're just not going to have access to this system. So a couple limiting factors right off the get-go there. So another thing to keep in mind is you're working with Mr. and Mrs. Jones, and they want to see what's good for them. If you're typically using Medicare.gov's Plan Finder, what you're going to need to do is get the ID and password from Mr. Jones, and then get Mrs. Jones' ID and password and be able to log into each one of them individually. So they're going to have to actually give you that information for you to be able to get into their account, to be able to run plan options through the Medicare.gov Plan Finder. So I think everybody can probably see the way this is going to impact the ability for many, many agents and many, many clients to be able to do what they typically would have done in previous years and really as of the upcoming annual enrollment period. So what do? You're an agent out there. You're working in Medicare. What's the solution? So here at Pinnacle Financial Services, today we're going to spend a little bit of time, and James is going to take over on this. And what we're going to do is we're going to go through our program called Connect for Medicare, which many of you may have seen if you're already working with Pinnacle. But it's a program we give every single agent contracted with Pinnacle Financial Services at no charge. Any agent working with Pinnacle in the Medicare arena gets this no charge automatically. And what it does is it was actually a system created by the same individuals, the same company that did the Medicare.gov Plan Finder. So it looks identical in many respects. It allows you to put in the same information that you would put in the Medicare.gov Plan Finder and run all the same type of plan comparisons. So we have a tool here that all you need to do is get hooked up on us here at Pinnacle. We're going to walk through it here, maybe take 15, 20 minutes, go through how it works, show you how easy it is. The beauty of our system is you're going to get your own login, and you're going to be able to save your client's information in there as well. So if you're adding a litany of 20 prescription drugs, we're going to show you how you can save that information in there. You're going to be able to save scope of appointment information in there. You're actually going to be able to go and enroll somebody through this system and get paid and be agent of record. So unlike Medicare Plan Finder on Medicare.gov, which is great for comparing stuff, our system is going to do all the same comparisons, but then it's going to let you say, Mr. or Mrs. Jones, we're also going to sign you up right here and get you done. You're going to get paid, your agent of record, the same way as if you did a paper application or if you did one of the online enrollment programs through one of the carriers. So it all works the same. So right now you're seeing our YouTube channel. So what I'm going to do is I'm going to click over to our Connect for Medicare on our website. I'm going to let James take over. Going to run through this. It's going to take maybe around 15 minutes, 20 minutes. If you do have questions, there is a question section in the system there. So please feel free to type in any questions. Even if we don't get a chance to answer them here during the call, we can reach back out to you afterwards and make sure that you have all the information that you do need, making sure that you're up to date. And if you do want to get set up with Connect for Medicare, if you're not sure if you're already set up and you're already working with Pinnacle Financial Services, it's a great opportunity to get it all going before AEP starts. This way you can do all the comparisons and you can go that extra step of making sure that you're getting your clients enrolled and, of course, moving on to the next sale because you're done at that point. So, James, I'm going to pass this back over to you. You got control, and hope everybody has a great rest of your day, and I'll talk to you soon.
Yeah, thanks, Bob. As Bob mentioned, my name's James Norton. I'm one of the marketers here on the Medicare side. So today we're going to go briefly through the Connect for Medicare online platform that, like Bob's saying, you get free access to when you do actually contract with us. And it's actually going to show each and every carrier that you are ready to sell for, for that time period. So once 2020 comes around, if you're not certified yet, for certain companies, they will not pop up. But just starting off here, you're going to be able to see basically the home dashboard. As Bob was kind of talking, I went in and just clicked the 2019 site button, went in, put in our generic login here so we can just kind of run some example quotes. And as you can see listed down here, you'll actually get a nice little breakdown of all the different plans or maybe enrollments you've done so far. Obviously, there's not a lot on here because this is just really for examples and, just for, webinar or those type of purposes. But it'll give you a breakdown of which type of plans you sell most, which plans maybe were started, maybe you just started the profile, you partially completed the application. But the good news is once you actually do start anything on here, it will save all of your information. So like Bob was saying, if you have a bunch of drugs that you're entering in for your clients and you're going to have to, say you enter in 15, 20 drugs and then 2 weeks later, they didn't enroll at the time, but then 2 weeks later they say, you know what, I've been thinking about what we talked about, and I think I actually do want to enroll. So can we get set up and can we run that quote again? I just want to double check my options. If you've previously done it on Medicare.gov, you'd have to enter in all that information unless you created an account for them and saved all that. But most of the time, I'm sure you probably didn't. But anyway, now you'll get the option to, it'll actually, once you start the profile, it'll save. You'll get all the log information saved on there. You'll be able to keep what health questions they answered right or wrong. You'll be able to see, like I said, all the different drugs, which dosages. So in addition, really, to having the option of just keeping all that information saved on there, when it comes to the following year, during AEP or whenever you need to get back in there to kind of reevaluate their case, you can just really update the information that's changed. You won't have to go through, and it won't be setting them up a whole new profile again. You can just talk to them on the phone really quick after, maybe you scoped them already, and you're saying, hey, Mr. and Mrs. Smith, I'm running your information here. Has anything changed from last year to this year? Great. Okay, let me switch it real quick before I send you over your options. Or, hey, nothing's changed. All right, I'm just going to send you over. It's automatically going to compute everything that's going to be competitive for this year. So it'll really help with your client retention and take a lot of that back office work of rerunning quotes and entering in the same information you might have already had done before. But with no further ado, we're going to move forward and kind of run a little mock quote here. As Bob was talking, so you have the agent-facing and client-facing capabilities of this website. We're going to go through the agent-facing side. So basically, this is what you're going to see if you're starting someone a profile, running them a quote. And then if we have time, maybe I'll briefly run through what the client-facing site will actually look like. It's pretty much similar. It's why we don't do both. It'll look pretty similar to what I'm about to do here, but it actually makes everything a little bit easier. You'll get the premiums in green and a little bit bolder and bigger fonts. So, like I said, no further ado, we're going to go here and start a consultation. So this will actually kind of give you, let me minimize this thing to my screen here. So what we're going to have is you'll have tabs all the way across the top here. I'm just reading some of the questions here, sorry. All right, so Jim has a question. So if we aren't contracted through you for a PDP carrier, the plans for that carrier will not show up. Correct, Jim. So that's both for Medicare Advantage or PDP carriers. If you only have United Healthcare with us, and in your area there's United Healthcare, Humana, Aetna, Cigna Health Springs, WellCare, all those plans, and you run quotes, it's only going to pop up United Healthcare. Only the carriers that you're actually ready to sell with us, with us. Due to CMS regulations, we wouldn't actually be able to offer you to do carriers that aren't contracted through us. All right. And then Lisa's telling me that the page hasn't changed yet. Let me go here and check. I mean, if anyone can pop in the question box, do you see this here, this Connect for Medicare page where it says profile, SOA, health, subsidy, drugs, pharmacy? Is everyone able to see that? I should be able to. I don't see why not. All right, question here. Yes, okay, so everyone can see it. So Lisa, if you're running any problems and your computer's not working, maybe it's just your connection, let me know and I can kind of fill you in what you might have missed. So here's going to be the starting page of the profile. So we'll just put in, let's do Joe Smith here, generic name. Let's do date of birth, 01, oops, got a little ahead of myself, 01/01/1950, okay. So zip code, I'm just going to use the one here for our office, 18974. So for those of you who aren't familiar with us, we're actually located just outside of Philadelphia, Pennsylvania, probably about 45 minutes outside. And we work in all 50 states, as Bob was kind of saying. We work everywhere. We have we have offices and agencies all across the country, East Coast, West Coast, down south. So wherever you might be doing business. All right, so it looks like, okay, everyone's saying they can see it. Cool. Hopping back to the question box there. All right, so email address, I'm sure you know when you've worked different websites, or I'm sure you've done a ton of e-apps before, you'll have the asterisk next to everything that you need to fill out. This stuff here, if you notice, actually won't require that you go through and fill this out, but any information you do put in here will auto-populate to the application. So sometimes it's better just to keep these things on here. Email address is definitely, I would recommend having an asterisk there, but obviously everyone doesn't have an email address, and if you just want to run a generic quote, you don't need one to do that. But if you're sending out electronic scope of appointment, which will be on our next page, or anything you're sending out application-wise is going to be done via email, so you want to make sure you plug it in. So I'm just going to put my work email here, jnorton@pfsinsurance.com. We'll just put the address just so you can see it, West Street Road, Warminster, PA, Pennsylvania. All right, continue. And again, this will kind of give you the little side-by-side. So if you ever go on here and you wanted to run a quick quote, you didn't want to have to enter in all this information, you could do start a consultation, put in the age and zip code, and just jump to compare plans. I do that sometimes if I need to do a quick doctor lookup or something like that. So I'll give you the capability on that tool. So here is the basically the scope of appointment page. So you really have two options here. So it'll either be if you already have the paper scope of appointment, or if you want to send it out electronically, or if you've already done it, whatever it might be. Let's see, let me move this. You can send this out right here, just hit email scope of appointment, and it goes out. What I would recommend would be that you go through and you run a mock quote yourself and send it to your own email first. It comes from like a DRX do not reply email chain. So you want to know what exactly is coming through and what your client's going to be looking at. This way, if you have to do anything like this over the phone, then you can kind of, you can explain to them exactly what it's going to look like. And then also when you do the scope of appointment and you're trying to see if they filled it out first before you want to continue, on your profile, it'll actually let you know, it'll notify you when someone completes the scope of appointment. So if you didn't get a notification and they're telling you they completed the scope, they probably haven't filled everything out correctly. And you can actually go on there and pull up a picture of it and see how much they filled out, so you can kind of tell them what they're missing. So that's a cool little feature. Quick little question popped up here from Bob. It looks like, so yeah, you have a question in terms of your setup with the different carriers here. So you should be able, from the looks of it, you should have access to all the carriers. Nothing should change for you here. But I'll have the marketer who handles your account and some of your agencies, I'll have them reach out to you and just confirm, but there shouldn't be a reason why you shouldn't get all carriers across your platform if they're all through us. All right, so we're going to hit continue here. So the next is going to be the health. So zip code already auto-populated. The age range based off of the birth date we included is already auto-populated. So health status. This is going to be, if you've ever done a Medicare.gov quote, this is going to kind of give you the breakdown of how much you're going to be paying based on your health and what type of coverage that specific plan offers. Obviously, they can't give you exact amounts here, but they can kind of give you a rough estimate of what you're going to be looking at. So, instead of just guessing, I think they're in fair health, if you hover your mouse over this question mark, it'll give you the breakdown of each condition and what, give you a little description so you can kind of figure out which one you can check off for your client. So at the bottom it says this information does not affect your plan premium. So this would be in case it's a med sup. It is used to calculate a more accurate estimate of cost with each available plan. In case you're wondering, on the consumer-facing site, it actually spells that out, and it spells out each health condition or health class, I guess I would say, and it'll say how you qualify for those. So when they go, it would say good health means you see healthcare providers only for preventative needs or an occasional problem. Fair is you see healthcare providers for one chronic or multiple health issues. And poor is you see healthcare providers for more than one chronic condition or may need an occasional major procedure. It'll spell that out next to each health class. So your client, obviously, given that they're probably going to be seniors, it'll be a little bit bigger too, a little bit easier to read. So like I said, it is pretty much the same, but something to keep in mind when you're going through this. And if you ran it, while this is loading, if you ran any quotes before too, on Medicare.gov or these type of personalized quoting tools, the health estimate is not going to be scientifically on, but the drug tool will. If you get all the correct drugs, dosages, the exact drug, and you pick the right pharmacy that they go to and they stay to that pharmacy or do mail order the whole year, that will be the exact number. So you can really, really count on that. So subsidy here. So are they on Medicaid? Are they low-income plans? Any type of subsidy? we're going to just check receiving the Medicaid as well as Medicare. So this way, all the plans will pop up. Any dual SNP or special needs plans will show for you in addition to regular Medicare Advantage plans. And about halfway through already, we're going to go over here to the drug portion. So you'll do some drug names. So I'll do a couple of them here. We'll do lovastatin. And it's nice they auto-populate. You don't have to try and guess how you spell them. Just get the first couple letters right. And we'll do 30 at 40 milligrams. And I guess we'll just leave it at 1 for now, just for time purposes. So we'll hit here. My drug list is complete. And again, while this is loading also, but when you run this and you're doing these quotes, if you lose power, lose internet connection, whatever it might be, it will cut off and it will save wherever you left off. So if you, like I said, if you put in 20 drugs, you didn't hit save or save profile, whatever, it automatically does it itself. So don't be worried about losing all that in case you do lose connection. So here would be where we're going to select which pharmacy they prefer to use. We're going to use CVS Pharmacy. I'm sure, as you know, will be favorited by some of the Aetna plans now that they're both merging. And we'll hit continue. It's going to load up here. And the only thing that's not on par with what Medicare.gov was is that you can compare two pharmacies at the same time. Unfortunately, you can't do that. But when I show you the drug breakdown, the drug cost breakdown, you will actually be able to compare it to mail order. So that's a good thing also. That's something you always want to look at. Sometimes, you might have a plan with better health coverage, but the one that has less health coverage, maybe it's a little bit better drug option for your client, and it's going to save more money that way. But what you want to do is, if they're not opposed to it, always switch on that mail order tab, and sometimes it could save them. It could be creating that difference between the two plans, and you can get them on, the cheaper drugs and get them on a plan that's better for their health co-pays and their hospital and drug costs, or hospital and doctor costs. So here we'll show you the breakdown of which plans will be best. It's going to list them in order of what the total estimated cost for the whole year is going to be. So as you can see, for this Humana Gold Plus HMO SNP Special Needs Plan, it appears that would be the lowest option for them. Obviously, if you have somebody who's not on Medicaid or any subsidy, they're probably not going to qualify for this type of plan. So then you have to choose the next best, which would be here, this Humana HMO. Also, make sure you don't click off the Medicaid and as well in addition to Medicare for every client, because you don't want to, as they say, you don't want to show them a Cadillac when they only qualify for a Honda. All right, so let's think we have a question here. Yeah, so Cindy, looks like you were just asking what I was talking about. Is there any way to prevent the dual SNPs coming up if your state that the client does not? Okay, so a little confusing, but basically, if they do not receive any subsidy, you can just not click that, and they shouldn't show up for you. So you won't have to worry about that. Explaining why they don't qualify for a special needs plan, and they want to talk to 3 other agents because they think they might actually qualify for them. All right, another question here. I'm in California. Will you be adding Blue Shield of California and Scan? I actually don't handle California, so off the top of my head, I'm not actually familiar with which plans we'll have out there. Yes, we have our pretty generic companies that are in most states: UnitedHealthcare, Humana, Aetna. But the way Blue Cross Blue Shield is actually set up is they take FMO contracts, which is what we are, at a state-by-state basis. So I don't know actually for California. I mean, I have it in some of my states, but not in others. So I will actually have either Jeff, Marcus, or Rob reach out to you, Roy, and have them let you know, if we have those plans in that area or not. Yeah, Cindy, that was the problem before where the SNP plans were coming up, regardless of what you selected. But that's something we brought up with our, with the company that makes this website for us. So we're looking to get that changed as soon as possible. But you actually wouldn't be able to enroll them. If you send it to them as a client-facing, or they ran their own quotes as a client-facing site, they wouldn't be able to actually enroll themselves because they actually need to have an agent with them to enroll into a dual SNP plan. So you'll see some of these plans here listed. What we're going to do is we'll do a quick comparison. So we'll do the non-SNP plans. We'll do Humana HMO. and the Aetna HMO. So we'll do compare now. All right, so as you can see here, we have the view details, send quote, and enroll. So right away, before I get into any more breakdowns, if you were to hit send quote now, it auto-populates. Looks like I spelled Smith wrong. But anyway, it'll auto-populate the information you filled out before, phone number, first name, last name, what would you like to send, quote, and enrollment, or if they trust you and they just say, hey, I want that Aetna plan, you can just hit enrollment form only. And how will you be sending this information? So do you want to email it, or would you like to mail it? If you just hit mailing address, it's not going to mail it out for you. It's just going to print it out, okay? So you don't necessarily have to do that. I mean, it's the same as just doing a paper route. But you can send out email. Here's a code here. So the reason why they have that code is because when you send this, you'll get 2 emails right away, probably within 2 to 3 seconds of each other. The first one will be the application, and the second one will be the code. The codes to let them have access to it and prove that it wasn't, something didn't go wrong. I'm pretty sure it's just a CMS compliant regulation, so they have to include the code. But again, send this to yourself before you send it to any of your clients, so you know exactly what it's going to look like, exactly what you got to do. But like I said, they come 2 seconds apart, and you cannot move forward with the application until that code is entered in. So you can read it off to them over the phone, or they can just, like I said, get it in the email. So you could hit send quick quote, and all the information has been sent. You can just hit close dialogue from there. So that would be, like I said, if you kind of run the quote, you ran the quote over the phone, or if it's a client, maybe you already had all this information saved, and they're expecting your email. They're capable of enrolling themselves, or maybe they have their son and daughter there, kind of helping them understand everything. You can just go here. You can, if nothing changed in their profile, if this is the second year that you use the system, or if you just ran it yourself and inputted all their information, after they filled out the electronic scope, you can just email them out the enrollment information, or you can just hit enroll now. And if you hit that, it'll actually take you to what looks like the company's website. And as soon as this loads here, okay, so you got Joe Smith, birth date here, phone number, email address, everything we entered in before. I didn't lie to you, it popped up and auto-populated in here. Also something you want to note, you actually have all the plan ratings, application links, all these different things, Spanish guide, benefits at a glance, all this stuff's all at your fingertips right here to the right side on the application. But basically this is just entering in an e-app from this point forward. And this will actually go direct to the carriers too. There's nothing where it goes to us and then we have to prove it and then it goes to the carrier. This will instantly go right to the carrier. So it's the same thing, same exact process for you as doing an e-application, electronic application. So that's kind of how you do the enrollments. So this could be if you're in the house with the client and you're just going to run it and enroll them right there. So I'll run you through what this kind of page looks like here. So you'll get some of the benefits and just the overall glance at it, the co-payments, max amount of pockets. Obviously, you could pull up the view details here, and you can go in and look at the co-pays more extensively and look at all those type of things. One of the cool things here is right here you can do the physician directory. Go in here, see if their doctor's in network, their specialist is in network, whatever you're looking for. You can go through, if you ran it before, it's taking you right to Humana's site. So it's the same as nothing different than what you've probably done before in the different carriers' websites. But the other little cool tool here is, as I mentioned before, the health costs are estimated. If something pops up, your client gets sick or they fall, something happens. Obviously, you can't really, if you put in that they're good health, you can't really guess that this is going to happen. So the plan estimate, might have shown a lot lower than what you paid for the year or what your client paid for the year, but that's just because there's some unpredictable circumstances. Obviously, that's why they have insurance in the first place. But one of the things you can scientifically, as I said before, nail down, what they're going to be paying is going to be the drug cost. As long as they stay consistent with whichever pharmacy they select, and nothing changes for them drug-wise, this will be the same. So we picked a pretty generic drug, lovastatin. As you can see, they're paying $3 a month. It's not much at all. But always check this mail order tab. Like I said, it might not be $36 for the year. Maybe it's a $300 difference in the year in drug costs, and it's a difference between them choosing this plan or a different plan, that maybe has a little bit less health coverage, but the drug, the drug coverage is a lot better. Always check this mail order tab because you can save them that. I've seen it before where it's maybe $500, $600. They do mail order, it'll save them that if they just do this instead. Sometimes, like I said, going from that $300, $400 to $0. If they don't mind getting that mail to them, I get it's their drugs and it's their livelihood, and they don't want to have to, depend on the mailman. But if they don't mind it, it could really save them in the long run, and possibly put them on a plan that's able to give them a little bit better, hospital and doctor coverage. So I got another question here. How is the scope of appointment handed? Does the carrier get it? How is the scope of appointment? Okay, so same question twice. So basically, when they complete the scope of appointment, it stays in our platform, and then when the carrier basically requests it, it automatically gets sent over just like the e-app. So it's the same thing. You can use the same scope of appointment if you just send the scope electronically, and then you want to do a paper app. That's fine. You can do that as well. Same thing. Obviously, you can do the paper scope of appointment and then do the actual application on here as well. It doesn't matter. We ask that, if you've been working with us, you probably know that we have the enrollments team here. So they go through and they overlook all paper applications that get sent through us. They log them. They're able to track them. And then we actually submit them to the carriers. But, we can catch different things like a missed signature or, missed date and things like that. Whereas, if it goes to the carrier, they're probably not going to let you know until it's, 48 hours past that deadline, or 48 hours past, when you wrote the application, and you're going to have to go in and rewrite that app. We might be able to catch it beforehand and let you know. But the point of me bringing that up is if you submit the applications that way and you've taken the scope of appointment via Connect for Medicare, just write it on top of the, the cover sheet and let us know. And then we can, therefore pass that over to the carrier and kind of let them know that the scope of appointment was taken, everything was done correctly. It was just one was done electronically and one was done by paper. So really, that's the breakdown of how the system is going to work. Again, if you get all the way down, you had to do a little drug breakdown, and then now you got them sold on the plan. Just hit enroll here, and I'll take you to the same e-app platform we saw earlier. So I'll go back. You get the modified drug list button here. So if you messed up with any drugs or they forgot about one, you can always change it. Or you could always just hop back here and just select on this tab, and it'll bring you back to the drug portion. So we'll go back to the compare plans. Just want to double check over everything, make sure I didn't miss anything. And basically, so up in here, I'm not going to click on it because it'll show all the information, for our principal that's listed on here. But if you go up to my account, it's as simple as making that client-facing website or enrollment tool that you want. If you click on that, you'll have a little link, and it'll say copy my personal URL link. You hit the little copy button, and then you go to your website or wherever you want to put it, and you make a little button that says online enrollment tool, and then you just tie that link to that button, and then you're set. There you go, right there. And if they come across your web page, Googling, or maybe you do a bunch of PNC or life or annuities, and they're on your website and they came across, hey, what's this online enrollment tool? And they click on it, they run their own quotes, and they enroll themselves. It's something that you're going to get paid on. So it's a great tool to have. A lot of the things that are changing in terms of marketing as well is that you're getting a lot of more seniors who are becoming more tech savvy. Obviously, they probably have grandkids that are pretty tech savvy. Everyone's Googling everything. It's no more of this. We're going to go to an educational seminar. These type of things are still happening, but not as frequently, and we're not getting as many turnouts really, because a lot of the leads we did beforehand where we're getting agents in these educational seminars, and you used to plan 10 of them, and then you get 10 to 12 to 15 to 20 people at each one. Well, now it seems like some of the times, obviously, if it's not happening to you, that's great because you still have a great lead source. But if you're booking 10, maybe only the first 3 are getting fully booked at 20, 30 people, and then the rest of them, maybe you're only getting 2 or 3 or 5 or 6, or only a little bit more. So you really want to make sure that your online presence is strong. And we'll teach you how to do that when you contract with us. And if you are working with us already, reach out and you want to say, hey, James, Jeff, Marcus, Rob, whoever you're working with, hey, I really want to grow my web traffic. I want to start popping up sooner when people in my area type in Dallas Medicare or Dallas Medicaid and Medicare, Dallas or just in the area MedSup versus MedAdvantage. There's different ways you can go about it where seniors can be typing those titles into Google, and your company or your corp or your individual name, your website can come up at the top of those filters, and they can click on your webpage. Oh, this person's got a bunch of stuff on this. Let me read it, and then they're reading a bunch of information on your website, and then they come across, oh wow, I can actually enroll myself right here through this online enrollment tool. That's cool. I don't have to meet with anybody. That's awesome. And they're confident in their capabilities online, and they're running the quotes, they put in their drugs, and they can figure out what the best plan would be, and then they enroll themselves. And that's really one of the biggest attractions to this platform is going to be. So obviously you can still send things out to your clients, and it makes things a lot easier on the agent side, but kind of the future of this insurance marketing is going more online and more internet-based. So this actually gives you capability to get yourself out there a lot more too. So kind of got a little sidetracked there, but the point of that little rant was just to let you know if you want to get interested in kind of growing your business more online and how to get up there in the Google searches. We've been doing it ourselves as an FMO, obviously not trying to get in front of clients, but we're trying to get in front of agents and agencies and show them what we offer and kind of inform them of what we can help them out with. And it's been working with us. We didn't really do it much a couple of years ago, and now we're coming up at the top of Google searches when you look up certain topics. So we're not just speaking and kind of just talking talking as if we just learned about it and that's it. We're doing it ourselves, so we know what works and what doesn't work. So give us a call. Let us know anything about that. If you have any other questions about this online enrollment tool, let us know as well. Again, I'm going to try and get to all the questions here, but if we can't, we'll have an actual Excel sheet that'll print out. It has all these questions on here with your contact information, and we will be in touch with you. Looks like we got some more questions. Something I actually didn't hit on is you got these couple tabs up here. So you got the MAPD or Medicare Advantage prescription drug plans. These are all in one. You got your prescription drug plans or PDP plans, really only sold with MedSup plans. But don't get confused here where this says Medicare Advantage plans. Well, how come this says 30 and this comes 7? This says 7. These are the Medicare Advantage plan without any drug coverage. Now, someone might ask why carriers offer this. Obviously not as popular as the MAPD plans who have drug coverage on it, but you get some clients such as veterans who actually have some drug coverage already, so they want a plan maybe that just focuses only on their health coverage and nothing to do with their drugs because they already get enough coverage through that. So you can get them on these type of plans, and maybe they get a little bit better health coverage. All right, now to the questions. All right, sorry, 1 second, scrolling down here. All right, so you got a couple. So, can the consumer compare the drug plan? So yes, the consumer, everything you see on here that we are comparing will be the same exact thing that your consumer will do if they do the consumer-facing website. They can do the same thing if you email them the quote too. You can do the quote and comparison, or I'm sorry, the comparison and the enrollment, or you can just do the enrollment as we're kind of talking about. So Dale's asking me, how do you create your own website? I don't want to get too distracted on this topic, and we can get into it. Dale, I'll have, I think you were asking questions, or no, that was Roy asking questions about California. Dale, I'll look up which state you're in, and I'll have that marketer reach out to you. It's usually pretty simple to get your own URL and website, but it's another thing to make sure that your website's compliant and has all the necessary information on there. Actually, we have a compliance team here, a compliance officer who checks all that stuff and make sure you are compliant so you can't get in trouble. Especially with having online enrollment capabilities, the carriers are going to be more likely to to check on your website and make sure everything's okay and compliant. So we have a compliance officer here that'll check everything out for you and look it over and make sure you're okay. So we got Cynthia asking if we can practice with this. Yeah, Cynthia, we definitely can. Your marketer can go over it with you on a one-on-one basis. Whoever that is, again, I'll have them reach out to you. So we got Diana asking, can the enrollment link be added to an external website, like farmers.com? Yeah, so that's basically what I'm talking about. If you have a website that gets a lot of traffic, I would think you might have to double check that with farmers. Farmers, whoever your corporate or however that works. I'm not really sure how they would look at it, but we don't care. I mean, this is just a link to get people clicking on here and enroll your your clients or have them enroll themselves. So yeah, you can put this on whatever type of website. It doesn't have to be a website that's specifically geared towards towards Medicare. The whole point of this is to, if you're getting other traffic with different avenues of insurance, they just another tool you can throw on there that they can that they can use and possibly enroll themselves and run their own quotes. So Dale, you're Florida. Okay, so that would be Dusty or Nick. I'll have them reach out to you and be able to tell you about that. So a lot of great questions on here. I know a couple people are starting to log off. If you have any other questions, let me know. I'll stay on here for a couple more minutes. Be more than happy to kind of fill you in on this stuff. And Cynthia also, or anyone else who wants the one-on-one practice, we can do the consumer-facing site also. So we'll show you what that looks like. And obviously, once you get your own link, you can you can look through it yourself. But yeah, I mean, we can do that on a one-on-one basis. So like I said, I'll stay on here for a couple more minutes. If anyone has any more questions, we'll answer those for you. But if not, I appreciate everyone getting on, and looks like we're going about an hour now. But thanks for everyone for logging in. Really, to wrap everything up and kind of summarize everything, as Bob was mentioning in the beginning, it's a great opportunity now, because before, I mean, we did the same thing as marketers. We would go on Medicare.gov before we had this capability, and that's how we ran quotes. We ran the personalized searches with entering in the drugs and the pharmacies, and now people can't Google that. Your clients can't Google that, and they can't go on and run their own quotes. So you won't have to. Basically, the only chance you'd be able to have to run quotes would be if you get your clients or prospects username and password. And with everything that goes on in insurance, with different fraud and people taking advantage of seniors, it's probably gonna be less likely that someone's gonna give that type of information out to you. So now you got the Connect for Medicare platform. You don't have to ask for all that. If there's an agent who's not contracted with us, they're asking for their password, and you're the agent who doesn't need it. So I think they're probably going to trust you more than someone that's asking for a lot more personal information, especially if they're just kind of asking, or just maybe just meeting and they market it out to them, and now they're asking them for personal information. So it's really going to separate yourself as an agent, and we think as an FMO, this is really separating ourselves from the rest of the competition. So I got another question about who should I talk to about marketing Connect for Medicare on the internet. So definitely talk to your marketer, but I don't want to tell you you're not going to be marketing Connect for Medicare specifically. You're more so marketing your website to get them to go on your website, but you can definitely still do blogs and different information about having online capabilities and putting right on these articles or whatever you want to do, that they can click on this link and run their own quote. So I wouldn't say that you're necessarily, you don't want to market Connect for Medicare with your personal URL, and that's the only thing you're pushing. You really want to market your website, not just the online enrollment. You want to push them towards your website. You want them reading educational information, things about you, what you do in the community, whatever it might be. But you want them doing that, and then they click on Connect for Medicare enrollment, and then they enroll themselves. It's a lot easier to promote a website that has 7 or 8 features, as opposed to maybe just marketing Connect for Medicare that really only has 2 features. I mean, they're 2 really big features, but your website gives you a little bit more things to talk about. So again, I'll stay on here for a couple more minutes, and I'll go on mute here, let everyone kind of digest everything, think everything over, and if you have some questions, type in, or if you feel free. Actually, I'll pull up our website, and I'll pull up our marketing page, and you guys, if you want, I'm going to have everyone reach out to everyone who's typing in questions on here, but if you want to just look up and write down the extension of a marketer you can reach out to, you can do that as well. So let's go. Sorry, it's a brand new website, so I'm trying to remember where we at. Well, there we go. Our team, sales team. So health sales right here. Email healthsales@pfsinsurance.com. We'll all get the email. If you want to send it individually to someone who handles your states, here's my name here. I handle these states listed below. So it's not a big deal if you're out of these states. If you want to call me anyway, you want to get some information on what I was talking about, just because you're comfortable with me at that point, that's fine. But you also have these other marketers who are just experienced. Some are even more experienced, and they can fill you in on everything you can do to really build your online presence and how to really utilize this online enrollment tool.